Assalamu alaikum. Welcome to this webinar by ISPU on substance abuse and addiction in the Muslim community. My name is Dalia Mogahed, and I am the Director of Research at the Institute for Social Policy and Understanding. This topic is incredibly important to our community and is an absolute passion of mine personally. And I'm just so glad that we finally made the time to talk about this, because it's an issue that so many people are struggling with, and yet rarely are we able to have a constructive discussion about it, and especially one that includes research. Before I get into introduce our wonderful panelists, I'm just going to go through some baseline research that we've done at ISPU just to kind of ground us in facts before we have this discussion. This is all based on our 2020 American Muslim poll. This report that we put out included data from a representative sample of American Muslims, as well as Americans of other faith communities. This year's poll is the 5th survey of its kind, and it provides a rare opportunity to compare trend data over several years, as well as across faith communities. So this is an additional analysis from that same data set that specifically deals with drug abuse and the stigma that folks often face when they are struggling. So here's the problem. According to the Addiction Center, the United States, the wealthiest nation on earth, has seen a decrease in life expectancy since 2014. One of a very strange, rare kind of phenomena of a country getting wealthier and yet actually seeing life expectancy go down. And what professionals and researchers and sociologists have said is causing this decrease in life expectancy is what is called diseases of despair. Substance abuse and suicide both contribute significantly to this trend, and Muslims are not immune. Just to give you a picture of what the problem looks like, almost 21 million Americans have at least one addiction, yet only 10% receive treatment. Drug overdose deaths have more than tripled since 1990. From 1999 to 2017, more than 700,000 Americans have died from overdose from drugs. Alcohol and drug addiction costs the US economy over $600 billion every year. In 2017, 34 million Americans committed a DUI, and 21 million under the influence of alcohol, and 12 million under the influence of other drugs. About 20% of Americans who have depression and anxiety, so it's 1 in 5, also have a substance use disorder. And more than 90%, this is really a scary statistic, more than 90% of people who have an addiction started to drink alcohol or use drugs before they were 18. So a lot of this is about young people starting to use substances. Americans between the ages of 18 and 25 are the most likely to use addictive drugs. And the American Muslim community is not immune. I think everyone on this call probably already knows that, but it sometimes bears needing to be said again. So here's what we found in our survey of American Muslims, as well as people of other faiths and no faiths in the United States. Though Muslims are the least likely to report knowing someone with an addiction issue, more than a third do know someone who is struggling with addiction. So 37% of Muslims said that they know someone in their faith community who is currently or has in the past struggled with addiction or addiction to alcohol or other drugs. And that's in comparison to more than 50% in every other group. So it is lower in terms of the percentage who know someone, and that would also include themselves, but we always ask it this way to allow people to have the space to be honest without having to disclose their own history. Now we wanted to measure stigma. What does the stigma look like? Just a second, let me just see if I can fix my headphones here. Okay, hopefully this is better. So one of the things we would hear over and over as we were doing qualitative research on this project is that one of the reasons that people don't kind of deal with the problem, seek help, seek treatment is because of the stigma, or one of the most isolating and hardest part of this of having to deal with addiction is the stigma. So we wanted to look at a measure of stigma, and one of the ways that stigma is measured is by looking at desirability for a spouse. So if you had a son or daughter, how would you feel about them marrying the following potential partner? One of the things we heard over and over, especially in a place like Dearborn, is, well, you know, if I go and get treatment, if someone knows that I'm getting treatment, then no one's going to want to marry me, basically. I'm not going to be able to get a spouse. So we wanted to see just how bad, or if this was an issue. So what we found is that indeed recovering addicts are the least desired potential spouse for a child among Muslims. And we tested a bunch of other, things. And this is the percentage who say that if their son or daughter married someone in this category, it would bother me. So a person who once struggled with drug addiction, but is now sober. So like the point being, this is something that happened in the past. It's not someone who's still in the middle of it, but is someone who's recovered. And that's still 54% of folks say they would be bothered by that. A person of another faith, 51%, a divorced person, a third, a person of a lower socioeconomic status, 26%, a person of another race, 22%. These are all percentages that would bother the respondent. But Muslims are actually not unusual. They're not different than other groups in this regard. Majority of all groups, including Muslims, said that they would be bothered by their son or daughter marrying a recovering addict. And that was across the board, no difference at all. Whether you're Muslim, Jewish, Catholic, non-affiliated, anyone, or the general public. Now, what makes Muslims a little bit different? It's not this idea around stigma only, but their attitude regarding how we approach people with addiction. Most Muslims favor more support for those struggling with addiction. So 76% say that my faith community should provide more support to those struggling with drug addiction. But 20%, 1 in 5, say that my faith community should be tougher on drug addicts. So that was kind of the choice, which comes closer to your point of view, more support or tougher. And that 20% is significantly higher than any other faith community, twice as high, even as white evangelicals, who tend to be very tough on these things, as Protestants, much higher than Jewish Americans, only at 6%. So twice as likely as sort of the general public or Christian Americans
to say that they think the solution is being tougher. It is a minority. The majority want more support, but it's still much higher than other groups. So that is the end of just sort of like the data portion. And I'm very excited to bring in our panelists to discuss this. And for more information, please go to ISPU.org and sign up for our mailing list, and check out our American Muslim poll at ispU.org/poll. I'm going to go ahead and stop sharing my screen so that we can all be on camera. If all the panelists could now just please join for our discussion.
Hello.
Okay, wonderful. Hello, Ali. Thank you for joining us. Let's go ahead and introduce our panelist. Let's start with Dr. Amer Raheemullah. He's a clinical assistant professor at Stanford University School of Medicine and director of the Addiction Medicine Consult Service at Stanford Hospital. We're also joined by Ali Sayed, founder and CEO of Hype Athletics and SAFE, Substance Abuse and Mental Health Services. We're so happy to have you with us today. Thank you so much for joining. Dr. Raheemullah, I'm going to start with you. I'd just like you to kind of give us a picture of the real, of what's on the ground. You're seeing patients every day. You're seeing the issues and the struggles. In terms of substance abuse at a clinical level, what are you seeing, and what do you think is the future of intervention in relation to substance abuse?
Yeah, thanks so much for having me, Dalia, and great to meet you, Ali. I'm really happy we're having this conversation. Addiction, the first point I would want to get across is addiction is a very treatable problem. And what we see in terms of challenges that arise with addiction is more so access to that treatment. And when we think about access to that treatment, there can be geographical barriers, there can be financial barriers, but then there can be also sort of perceived barriers people have. And you touched on shame and stigma. We certainly see that in the broader community and absolutely in the Muslim community as well. So shame and stigma can be a problem in the sense that it can help, it somewhat kicks the can down the road and doesn't really treat the problem. So in other words, it's like a fire. Either you can focus on putting out the fire, or you can focus on covering or containing the fire. Both have their value, but of course, putting out the fire and solving the problem is the primary goal. And then you want to consider that sometimes just containing the fire will simply just fuel the problem. It'll just fuel the problem and enable it and cause it to continue to go on. So with addiction, you have that as a barrier. Another barrier that I see in treating addiction, and certainly in the Muslim community as well, is just the conceptualization of addiction as a problem. So it's a very complex problem, and it can be comfortable to reduce it or generalize it or reduce it to something a little bit more familiar or a little bit more simple. So addiction has many components. It has psychological components. So when we think about the psychological components, data shows that people with adverse childhood experiences, that means trauma, that means a history of sexual abuse, physical abuse, emotional neglect, have a higher risk of developing an addiction later on in life. So there's psychological components. And really, you start to move away, just with understanding the psychological components, you start to move away from addiction being this seeking of pleasure and more so an idea of escaping pain. So psychological components, there's certainly medical, biological components. So you have people that are through with their addiction, but they still have the very real problem of, I have chronic pain. What do I do with that? I have a chronic injury that I have to address. Sure, I'm addicted to opioids, what do I do with the pain? So, you know, there's psychological components, there's medical components, or withdrawal as a medical component. I want to stop using, but how do I deal with withdrawal? How do I practically deal with that hurdle? So there's psychological, medical components, there's family, social components. So you can get the best treatment in the world, you can have the best medical treatment, best psychological treatment, but if you go right back into the old stomping grounds, or you go right back to home where you have somebody that's using substances there, or you have somebody in your family that's using substances, you know, this is something that needs to be addressed. And all these components work together to really lock addiction in place. And of course, you know, I would have to mention there's spiritual components and religious components to this. And, you know, religion and spirituality in several studies have been shown to be protective against substance use, to protect against using substances. And also studies show repeatedly that spirituality and religion integrated into recovery is associated with better outcomes, more days of abstinence after a treatment program. So going back to reducing this problem to something familiar and simple, there is a temptation to, if I'm coming from more of a religious background, or if I'm coming from more of a psychological background, or a more medical, biological background, to just simplify it to one of these things. And that's great, but you know, all of them need to be addressed simultaneously in order for people to really start to get traction on this problem. You know, in terms of treatment, when people do tend to find that it's time to seek treatment, there are many ways to make that happen. And I can talk about that as well eventually. I don't know how long you want me to go to answer this question. So
no, thank you so much for laying that out. And I will come back to you to talk about how do we get to treatment. So Ali, turning to you, we're so happy that you're with us because you're actually in the trenches trying to help people out in, you know, in the community. Tell us a little bit about why you started SAFE, the Substance Abuse and Mental Health Services in Metro Detroit, and what you see in your everyday work. You're muted, Ali. You need to unmute, please.
Sorry about that.
Thank you.
Sorry about that.
No problem.
I thought you guys were doing that on your end. I appreciate it.
Oh,
so thank
sorry.
you.
Well,
thank you to the Institute for putting this together, ISPU. Thank you for putting this together. Thank you, Doctor, for all your awesome words. You nailed everything, religiously, spiritually, physically, mentally, emotionally. All those aspects are definitely, you know, critical. And when you look at the aspects of recovery. So, you know, to answer your question, I started SAFE. Really, we started back in 2008. And the intent then was to provide an outlet for kids using sports integrated with a substance abuse prevention or a life skills or a group mentoring type program, so that children were learning more than just basketball or soccer or football and whatnot. And prior to that, parents were coming to me and coming to our coaches and expressing concern with their kids. You know, hey, my son is potentially smoking marijuana or drinking alcohol or other signs, right? Skipping school, hanging around with the wrong group, not really social, stuck in their room, overweight. These are all signs, right? These are all actions that you know, things that we have to act upon once we see red flags. So initially it was a prevention and education formula for us. And I'm an advocate for prevention and education. I strongly advise schools, from the elementary level to high school, religious centers, our mosques and churches and synagogues, all these guys have to fulfill this prevention and education model. Has to be where we're bringing in professionals such as pharmacists to explain the side effects and the long-term, short-term effects of medications, bring in primary care, or even surgeons to talk about post-surgery care. What happens if you are addicted to Vicodins and opioids after your surgery? So initially, hype was that. And, unfortunately, in our community of Dearborn Heights, a little bit of Detroit, we're seeing a lot of Muslim brothers and sisters dying from this, right? And we had to act, right? As an organization like you and us and other entities, we have to remain agile, right? We started off with sports, training camps and leagues and all that good stuff. It was fine and it was dandy and it was blossoming, thank God, alhamdulillah. But we have to assess and evaluate these needs that are required to be fulfilled by entities like us and others, within different communities. Once we started attending funerals and once we heard, mothers and fathers cry and pleading for some direction, some assistance, there is nothing, right? There was nothing 5, 6, 7 years ago in this area that offered these types of services. So we took it on head on, literally. We built relationship immediately with rehab centers, outpatient therapy, psychiatrists, therapists, caseworkers, case managers, peer recovery coaches. We brought them on under our umbrella and began a referral program initially. Hey, we have this client, he's Muslim, she's Muslim, we need accommodations. We're pushing spirituality. Could you accommodate? Are you willing to allow them to pray peacefully and protect their prayer? Are you going to allow them to have a religious book with them, because that's our belief, that's our following, that's our standard, right? We express to the patients, to clients, that spirituality is a major component in recovery. It really is. We believe it and we preach it. And every year, alhamdulillah, we've been sending someone to make pilgrimage in Mecca after their 1 year clean. Every year, some years we've even sent 2 people since. So like that's where we are today. We've served well over 800, of which 95% are Muslim men and women. We're proud and we say it loud that, safe. This is where our dedication is, to serve the Muslim community in all of Michigan. But we have Chicago, we have California, we have Canada, we have from all over the US flying into Detroit, living in our 3-quarter house, living in our outpatient therapy center in Lincoln Park, and they're healing, and it's beautiful because we're able to do that collectively with a large team of professionals, and alhamdulillah, we're doing very well with that. I hope I answered that.
Thank you. That was great. Yes, you absolutely did. And really, may Allah strengthen and reward you for this incredibly important work. Dr. Raheemullah, back to you on the question of seeking treatment. How does someone find help? Someone struggling with this right now, what do they do?
Yeah, so that's a great question. When it comes to the point where people are wanting to seek help, there's a few routes. There's 3 routes I can talk about that I usually bring up. One is the therapist route to find and get into addiction treatment. So people can find a therapist that they previously worked with, or they can find a therapist that's trained in addiction, or find a therapist that they worked with who may not be interested or who may not be experienced with addiction, but can refer them out to work with a therapist that is experienced with addiction to evaluate them and get them to the appropriate level of care. The second route is an addiction medicine doctor, or a doctor that's trained in treating addiction. So it could be an addiction psychiatrist, an addiction medicine doctor, or it could just be a doctor, a primary care doctor that has experience in this area, who can then evaluate them and they get them connected to the appropriate level of care, the level of treatment, the intensity of treatment that they need for their specific problem. The third route is the treatment program route. So having connected to a treatment center, or like a rehab, like an intensive outpatient program or a residential program. These tend to look a little bit differently depending on the community that you're in. So you can reach out to an addiction program, and they will typically have a process where you can do an evaluation and do an intake, which doesn't necessarily commit you to go into the treatment program, but gives you a little bit of an understanding of what the problem is, because some people tend to need some validation that, yes, this is addiction. It's not just substance use getting a little bit out of control. And yes, this is addiction. And thus, yes, this is the type of treatment that you need. And then of course, there's amazing interventions and community interventions, and like the one Ali's talked about. That's really, beyond amazing that we're having conversations about this, and then that there are interventions in the community and people responding to the need. Like this in such a practical and important way, and just hope that things like this get replicated all throughout the US and world. So, one thing to consider though is, addiction is complex. The old sort of ideas around addiction treatment was to take people, put them into sort of a cookie cutter treatment setup. And if ready for it, they sort of get dismissed as either being in denial or not ready for treatment. The newer methods of addiction treatment, since the problem only gets worse, the newer methods of treatment that tend to be more successful is finding out where people are in terms of their recovery journey, explaining what the menu of options are in terms of treatment, and customizing treatment to meet people where they're at, and working with them where they're at. I hope that answers your question.
Yeah, absolutely. I'd like to talk a little bit about the stigma though, with both of you, because I know that you both have a lot of experience with that. Can you tell us a little bit about how stigma really impacts a person's likelihood or ability to seek treatment? And what is the dynamic of the stigma around this issue in our community and the outcome of that?
Sure, yeah.
Ali, let's start with you. I know you have a lot of experience with that.
We do. And definitely it's a serious problem. The shame, the embarrassment, the disappointment, and the whole household and the family of that family. It doesn't discriminate though, right? So stigma is present in all communities, in the Arab community, it's coupled with the shame and disappointment and so on, but it's also cultural, right? Our culture frowns upon this, but primarily because they just don't know, they just don't understand mental illness. We've launched a project 2030. Within the next 10 years, God willing, we will have educational material for parents in our community in multiple languages so that they can understand it. Understanding let me make a statement. Not about 20% of our community, statistically, who have been diagnosed with either depression or anxiety, 20% of them have a substance abuse disorder, right? Which is severe. So 1 in 5. Now, depression and anxiety.
So that's not our community. That's the general public. I don't expect our community to be that much different, but that is for the general public.
It's not. Yeah, it's not that much. This is what we've conducted from internally as well.
Oh, okay.
We've found out that we're at 19.6, 19.8% of our population that we serve. What can we do about stigma? We just had a young kid, 20-year-old kid, pass away, overdose, and the family wouldn't talk about it. And he grew up in my parents' neighborhood, so I know the kid. He's 20 years old. I watched him grow up. Didn't even suspect. No one suspected that he even had a drug problem. It was unbelievable. So disappointed. I grew up with his father, knew the whole family. Why not talk about the evident drug problem in the household? I mean, you guys knew he was on drugs and didn't say nothing? Did you know that we offer help? Of course we knew you offered help, they replied. Why didn't you say something? Now we're burying this kid, right? So sooner than later, and it's happening. We're seeing this, and I'm sure Dr. Raheemullah, did I say that right? Raheemullah.
Yeah.
I believe you're witnessing this too, for sure. We're seeing more and more come out at a younger age. I have a 16-year-old kid whose mom and dad came to us for marijuana. He's addicted to marijuana. You'd never suspect a 16-year-old smoking marijuana, but majority of addicts today have tried a drug, alcohol, or even tobacco before the age of 18. We know that statistically, right? So more and more we're coming out and speaking, right? More and more our religious centers are speaking of this and saying, don't be ashamed. It's a mental illness like gambling is, like biting your fingernails is, like other things are, right? So we can treat it. There is treatment. And I know that the topic that was discussed prior, the first topic that Dr. Raheemullah presented with regards to marriage and other factors that are making it hard for people to come back to society, come back to life, real life, and live. There's a lot of challenges to that. And that's why stigma in our community, it takes precedent a little bit more than in other communities, because we know that we're not going to accept somebody that's in recovery. We're not going to accept a former addict. We're not going to accept, but times are changing. It's just going to take some time for us to prove that these individuals can heal and they can do more good or as much good as anyone else in the community. We just need more time. It's new to the entire country. This entire issue has been really present since the 80s. So we're talking 40 years, really, of having a very severe issue with addiction that we've been able to study and collect data on and measure and do all that good stuff. So I hope I answered that.
Thank you so much, Ali. Dr. Raheemullah,
Yeah,
can you talk a little bit about the impact of stigma?
Yeah, absolutely. And I can say certainly we're seeing Muslims with addiction from all walks of life, overdose death in the Muslim community. And it's really heart-wrenching to see overdose death in general and how addiction is impacting the community in general and then in the Muslim community in particular. So, shame is it's an important emotion and it's an important mechanism within societies. It serves a purpose. It's painful, and because it's painful, it helps people move towards a goal. And it's protective. It protects us from behavior that we as a community agree is wrong. So, and modesty is an important thing as well in our tradition. The issue is with substance use, sure, a child that's smoking marijuana or somebody that's using drugs or alcohol in the community, sure, we don't want to glamorize that. We don't want to publicize that. I think what we're talking about particularly here is addiction. Addiction, when it comes to addiction, it can become really complicated. The shame and stigma, it's really almost like a part of the addiction. And shame is really a part of the problem in the sense that when you understand addiction is this problem where people are caught in this loop of using substances in order to regulate any painful emotion. Then they get caught up in this loop of having shame and then automatically, reflexively, and compulsively alleviating that shame with the use of substances. So it's almost part of, if you want to look at it in a sophisticated level, it's almost part of the problem. And in order to get on the problem and get the goal of shame. So again, remember, shame is in order to help prevent problematic behavior. So in order to get the goal of preventing problematic behavior with addiction, shame needs to be suspended because it's no longer working. It ends up adding to the problem. So shame and stigma, rarely, not every behavior that somebody with addiction does gets a free pass. We're not saying that. We're saying that in order to solve this really important problem, we need to address it in this way, because shame is no longer a functional, helpful, constructive aspect to these particular problems, and it needs to be addressed. Now, some of the things that I'm seeing, in my experience, and Ali, you can probably attest to this as well, is shame is almost used to avoid the problem. In other words, families will use shame in order to avoid what a family member who has addiction says about them. Or
I agree.
A person with addiction might use shame and stigma in a way to avoid the problem that's going on with them. Because of course, again, modesty is something that's encouraged within the deen, within our tradition. But of course, there's modesty that's praiseworthy and modesty that's not praiseworthy when we comprehensively look at it. And we have to really we have objectives. There's really a rational, a process that requires a rational strategy. And if it's not meeting those objectives, we really need to think deeply about how to solve this problem. And I think that, Ali, you're absolutely correct. We need to have education on what is addiction. So once we understand what is addiction, then it can be really easy for people to understand what the next steps are and how to navigate the very chaotic, painful, and complicated course of addiction, which shame is a part of. And doing that in a practical way on the individual level, on the family level, on the community level, with amazing community interventions that bring together all the important aspects and deliver that at the level of the masajid, the level of Muslim community organizations. All of those levels are incredibly important, starting with the areas that are most in need all over the US. Addiction is a problem in the Bay Area, it's a problem in Chicago, it's a problem in cities in Michigan, in Dearborn, it's a problem in rural, it's a problem in New York, it's a problem in rural areas amongst Muslims. It's great that we're having these conversations because people are really suffering in silence.
One thing that you guys talked about, both of you talked about, but especially you, Dr. Raheemullah, is the shame of what the addiction means or reflects on the family. And that's one of the obstacles to getting treatment or to facing the problem. But it also means that there needs to be much greater support for the family members, for the parents, for the spouse, even for the children of the person who's struggling with the substance abuse problem. What can you tell us and tell our audience about support or resources for family members who are trying to support and trying to help and living with a member of their family that's struggling with this? Because as you know, it can be very isolating because the stigma means, something's wrong with them, also that this is happening in their family.
If it's caught early enough, typically primary care physicians, typically schools like high schools or middle schools, if it's caught early enough, again, there's many red flags that parents don't consider red flags. So it's even educating them on those behavioral issues as well. But related to your question and how to overcome, how does a family seek this help? Where do they go to get this help? There's many organizations, many primary care offices that will offer direction on addiction. They understand the type of drugs that are being prescribed, the withdrawal, the symptoms, all that stuff. I wish I can just say it's as easy as, let us know, we'll come by and conduct an intervention and, get the family all there and we can, complete this process and get this person into a rehab center and have them detoxed. And, but it's more complex than that. It really is. You need the addict to agree to seek help. You have to get the addict to agree that he has even an issue of addiction, or even if it's co-occurring with a mental health disorder, because they don't see it, right? You can't see, it's nothing tangible that you can touch. These mental health or behavioral health issues are they think it's normal to themselves. And my recommendation is seek help initially from a primary care physician, immediately, and let them know of the problem, and from there your primary care physician should guide you to an addiction specialist if they're not licensed as one, a psychiatrist or a therapist, so they can get proper help and proper diagnosis plans and treatment plans, and if necessary, referral into a rehab center. Now many rehab centers are not affordable. Some require only a primary health insurance. They won't accept Medicare or Medicaid, for example. Some health and some rehab centers don't even take insurance. They're a cash only type business.
Right.
And and then others take Medicare and Medicaid, but the standard of care is reduced, right? Because the majority of addicts that are on the streets, that are low income or have other social disparities, have the Medicare or Medicaid or apply for it in the process of going to rehab. So these facilities are kind of, lower quality than, the primary care insurances or primary insurances or even the cash basis. So, doctor, I hope you can fill whatever I've missed.
Yeah, that's great. Absolutely. I mean, in regards to families who are suffering with this problem and seeking help, it's almost like the person with addiction has a completely separate set of problems than their family members. Although they live in the same house and they both are being troubled by addiction, it looks and feels on a daily basis as something else. Somebody with addiction, their concern for the day might be withdrawal, might be how do I make money? How do I get transportation on a daily basis? Or how do I sort of fix, manage, coordinate, and recover from this problem from the previous state? Whereas a family member, it's how do I deal with this resentment, this broken trust? How do I get my family member to stop, get into treatment? How do I live a life where everything I plan or do has to be planned around this person with addiction? And how do I deal with this ball of rage, resentment, not necessarily rage, but resentment, loss of trust, and so on and so forth with this patient, with the family member? There's a lot of resources out there for family members who are struggling with addiction. I would really strongly encourage people to take advantage of that. So from the peer support level, there is CRAFT, which is a really great therapy intervention. It can be available in your communities, but it's also available online. It's smartrecovery.org is an online peer support program that has CRAFT, C-R-A-F-T, which stands for Community Reinforcement and Family Training. It's a peer support, but also a program where you get education on the problem of addiction as a family member, because there's three things that you really need to address as a family member. How do I take care of myself? How do I take care of myself? How do I communicate and interact and live with somebody with an addiction? Because it's a long-term project. You can't really just take it from one place and put it in another place. There's nothing we can do there's no sort of chess move to get the person in the place that you want. It requires a lot of self-work, and it requires a lot of knowledge around how to address somebody with addiction. So how to take care of yourself, how to communicate with the person or interact with the person with addiction, but then how to do all of that in a way that increases the chances of the person with addiction to get treatment. And that's something that CRAFT has really studied as opposed to other interventions, is how do I, as a family member, not only take care of myself, but what can I do? How do I communicate? What's the strategy for me to more effectively get my family member into treatment themselves? There's also Al-Anon, and then there's also other family support groups. Al-Anon is based on the 12-step program, and it's an offshoot of that. And that's available in people's communities. A lot of these things are available online. And of course, if you live where Ali's at, go reach out to Ali and go get connected to all of his services, because that's fantastic. We have something in the Bay Area at MCC that's starting a support group through the Muslim Community Center in the East Bay. So you can check out their website if you're in that locality. And I'm sure there's things which is a support group for family members. We conducted one in the past based on there being a need in the community about a year ago. And we collected some data on what people would be comfortable doing. And we decided to implement that intervention as an online intervention, cameras off, where we could provide just education. But there are things like this that exist that are available right now for people who are struggling with this. And there are things that can exist that we can customize specifically for the Muslim community. And then one thing, I want to touch on is when we talk about the Muslim community, it's so diverse. So when I'm seeing Muslims in my office, I'm seeing Muslims from all different backgrounds. And particularly when I see addiction in general, I see people from all different backgrounds. And it's, I think when you close your eyes and you think about somebody with an addiction, you'll have a lot of things that come up in your mind of what somebody typically with an addiction has. And that can be through media or popular culture or wherever. And then you have like somebody in your family or amongst your relatives or in your social circle or that you've heard about with addiction in real life. And if you look at the person that you think about in your mind and you look at the person that you actually know, they're very different people. The person that you actually might know with addiction, the problem is we consider them as like the anomaly. Like they're not like your typical addict.
Yeah.
They're a typical person with addiction. But in reality, all I'm seeing is anomalies in my office. You see people with all different backgrounds, socioeconomic statuses, and all different ethnicities. The problem with Muslims in America, we're so diverse. When I'm dealing with the broader community, I have a different catchment, and it's less diverse. With Muslims, we're dealing with an ethnically diverse community, and there's putting the spirituality, religion aspect aside, culture plays a huge part in that. So what might work in one specific cultural community may not work in another. What works in one location may not work in another location. The importance is to really hear your community and listen to your community. That's why qualitative data is so important, to really hear like what you're doing, Dalia. It's really so important because we can, based on what we're hearing, it might be different than what we're expecting. And then from that, we can iterate and refine and provide something that's meaningful for people. And the second thing I'll mention is we're diverse in terms of ethnicity, but we're also diverse in terms of our practice, in terms of Islam. I mean, we all in our own individual lives go through different varying levels of practice. So it's just not, it's not possible to know it all at once. So you have people that will be coming from all different backgrounds in terms of their level of practice of Islam. So you have people that will identify strongly with Islam, but they don't practice necessarily at the same level as somebody else. So all of these things are components of addiction that need to be addressed when we talk to somebody with addiction. So you have these cultural components, you have these religious, spiritual components, and then all the other stuff that I mentioned that are important to address with families and individuals.
Thank you so much. We're going to go to the Q&A now that we have from our audience. Dr. Amina McLeod is asking, have either of you explored the treatment programs used by African-American Muslim communities to combat this problem?
I personally didn't know that there was one specific method used for African Americans or the African American community. Is that what the question entails? Like,
it's asking, have you explored the treatment programs used by African American Muslim communities?
I didn't know there was anything different.
Okay.
Yeah, so I think, two books I'd bring up that I think are really important to talk about the addiction epidemic in Black communities. One is Isabel Wilkerson's book, which is Caste. She talks a little bit about addiction, but she talks a little bit about addiction in there. But then more importantly, Michelle Alexander's book, which is The New Jim Crow, which she talks heavily about addiction and the criminal justice system. So those are really good books to start talking about addiction. And again, addiction has many components. The criminal justice system and ethnicity are two very important points that Michelle Alexander talks about in a very important book. In terms of therapy interventions in Black communities, I think that is something that's important to look into. If those are communities that you're a part of or that you're looking to intervene on, I think whatever communities you're part of, whether it be an Afghani community, whether it be a community that's predominantly Somali, whether it be a community that's predominantly South Asian, whether you be in a community that's predominantly something else. I can't name them all, there's not enough time. It's really important if you're dealing with Muslims in the addiction in the Muslim community, that race is a really important part of that, or culture is a really important part of that. And depending on what community you're coming from, to really customize your Muslim intervention from the Muslimness, but also take into consideration the ethnicities and races of those specific communities. And if you can do that, then you can really be incredibly effective. But then also, I wouldn't assume, just because we're part of a particular community, ethnically, that we know the needs of the addicts within that community, the people with addiction within that community, because there's a process of really gathering qualitative data or just listening to what the stories are, what people are asking, what people need. Hope that helps.
Yeah, I think that Dr. McLeod may be referring to Mulati Islami. It's sort of a 12-step program that was developed for Muslims, and it's really, a contribution of the African-American Muslim community. So that's just something to check out. Mulati Islami.
Malati.
Military Islam is a 12-step.
Yeah.
Yeah, it's a
Military Islami. It's a 12-step program, sort of from a Muslim lens.
absolutely.
Are you familiar with it, Dr. Raheemullah?
Yeah. So military,
Both of
so 12-step programs have been shown to be effective. There's a Cochrane review that came out about a year or two ago that looked at 12-step programs and found them to be incredibly effective. There's also Project Match, which looked at 12-step programs, and it's something that is just helpful. Military Islam is taking the 12-step program, which has been shown to be effective, and customizing it for Muslim communities. So I don't know if, and this might just be my ignorance, I don't know if it's specifically an intervention that's intended for the Black African-American community, or if it's just a 12-step program that's intended for the Muslim community in general.
Yeah, I think it's for the Muslim community in general. It's just that it's been used, it's been sort of pioneered more in the African-American community. So that was a piece. Dr. James Jones, Salam, where does the African-American Muslim community in this narrative, particularly because the impact of substance has been more impactful over time because of mass incarceration and so forth, and programs like Mulati Islami, National, and We Can in Baltimore that have served diverse populations. So it's I think, we sort of addressed that just now. Just a statement by a viewer: addiction is not a reflection of the person, and the stigma surrounding a person that gets high keeps them from seeking the help that they need. Stigma is like oxygen to a burning flame. Very true. And then another request, so this is something we can talk about offline, but Dr. Amina McLeod is asking if it's possible for all of us all of you to be on our program on Critical Talk for Muslim Network TV. This is a critical issue, she says. So that's an offer for another program. If you guys are interested, we can definitely discuss that offline. And another question.
Yeah, absolutely.
Okay, great.
Is this
you kind of froze, Dr. Raheemullah. What was that?
Yeah, you're freezing, Doctor.
I'm sorry. Yeah, you're okay, we'll get right back to you. Another question that just came in: what are some resources you can recommend for families of Muslims with primary mental illness dealing with secondary addiction issues? So resources for the main issue is mental illness. Many times the substance abuse becomes a form of self-treatment to address the mental health challenges. Any resources would be appreciated. Very good question. Completely true.
That is actually very accurate. Absolutely, it is. self-care and self-treatment and self-diagnosis is one of the root causes of addiction nationwide. People feel like they can resolve their own issues within their own household. Resources include psychiatrists, therapists, peer recovery coaches, talking to members of the community that specialize in this field. Depending on the area, I mean, for our area specifically, our collaboratives and partnerships are very broad. Hospitals, mental health facilities, detox and rehab facilities, and outpatient therapy facilities. But when it comes to psychiatrists and therapists, and this is just our take, we've collaborated with specifically Muslims, because these are addiction specialists in primary care. They're specifically Muslim because our community requires some level of like being familiar with who we are, what we do, and how we live, and the stigma and our family makeup and all that, in all of our communities. So we kept that within, and I would recommend seeking support from those types of professionals in your area. Again, I recommend starting with the person's primary care physician, letting that primary care physician know what the behaviors are, whether they be self-diagnosing or using any type of substance to treat a mental illness.
Anything you'd like to add to that, Dr.
Yeah.
Raheemullah?
Thanks, Dalia. I'm sorry, I missed the question because I froze. And
Oh, okay. So it was a question regarding resources for folks who are dealing with primarily a mental illness and then a substance abuse problem as a secondary issue.
yeah, that's a really great and common question. So there's a lot of dual diagnosis approaches out there where we look at the mental health aspect and we look at the addiction aspect, and we treat that together. So for example, you'll have treatment programs, we'll have clinics, and we have interventions that specifically combine those two things. And the reason why that is because you really can't get traction on the problem until you treat both of them together. So if you have the best mental health treatment in the world, if you continue to use substances release really strong feel-good chemicals in our brain that will induce depression and anxiety and complicate the recovery from mental health conditions. So if you get the best treatment in the world, but you don't get the if you don't get addiction treatment, you're not going to get traction in the majority of situations on this problem, and vice versa. If you get the best addiction treatment in the world, but you don't address your mental health conditions, those conditions can be so distressing, it's very hard to get traction on your problem. And there's also something to be said about drugs and alcohol themselves. So we see a lot of people that will never have a history of mental health problems start using a specific substance, and that substance will induce depression, because that's what substances do. There's a high and then there's a low. And so there's some people who, just by virtue of them getting addiction treatment, their mood will improve. But for dual diagnosis patients with a diagnosis of a mental health condition and addiction, it's important for you to have both of those things addressed either in one program, or they can just be different components of your recovery.
Thank you. That's extremely helpful. So your feedback is very important to us. We'd like you to please answer these 3 quick questions about the program. So they should be in front of you in your screen right now. A follow-up email will also be sent next week with resources relevant to the topic. So please feel free to share any resources with your network. And then please join us next week on Tuesday at 3 p.m. Eastern Time, where we're going to discuss supporting and centering Muslims with disabilities. I want to really express my utmost gratitude to the 2 of you for being with us today and sharing your wisdom and expertise. I think this issue is incredibly important. is impacting so many of us and yet is rarely discussed. So thank you so much for sharing your time with us.